Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to be speaking with Dr. Jeanne Lomas, Director of Allergy Services at WellNow Allergy, to discuss ways to help patients see a decrease in their symptoms so they can get outside and enjoy this summer weather. She's also going to share some tactics on how to get through allergy season, why over-the-counter drugs don't always work, and when it's time to seek medical help. Welcome to Health Professional Radio, Dr. Jeanne Lomas. Thank you for taking the time.
Thank you, Neil. I'm really happy you asked me to speak with you today. I'm really passionate about allergies and definitely always excited to help educate anybody that wants to learn more.
Well, what brought you to, the allergy space? What interested you in that area in medicine?
Yeah, that's a great question. So my initial training, I'm board certified in pediatrics. And then while I was doing my pediatric residency, I actually took an interest in allergy and immunology and really liked the type of care that I was able to provide, and that we were able to potentially cure people of their allergies with certain therapies. So it was really a powerful thing to be introduced to, and I enjoy my work.
Talk a bit about being Director of Allergy Services at WellNow Allergy and talk about their mission.
Thank you. So my current role is the Director of Allergy and Immunology for WellNow, and I really transitioned from a career in academic medicine about a year ago to join WellNow full-time. And for listeners that are unfamiliar, WellNow is a growing urgent care provider in the Northeast and Midwest, and really we are starting Allergy Services. We started Allergy Services with them last year in order to increase access to high-quality allergy care and bring allergy to patients that normally would not have access to allergy services.
Well, it is summertime, and, you've got the rising pollen counts, grass in the air, all sorts of things flying around. What are some of the most common summer allergies?
Yeah, so in the Northeast up here, so I'm located in New York State, where we really get a variety of seasons. The most common summer allergies involve pollen-induced symptoms, right? And so in the springtime, we get the tree pollen. In the summer or early summer, we get the grass pollen. And then in the late summer to early fall, we get things like the weeds, which are ragweed as the dominant pollen. And so most of the symptoms that you're going to get from allergies in the warmer months are pollen-induced.
Do these allergens present with different symptoms based on whether it's pollen, grass? Are all the symptoms pretty much identical?
Yeah, good question. The symptoms of allergies in general overlap a lot. And it's basically no matter the trigger, whether it's pollen-induced if you're outdoors or indoor allergens, which would be things like animal dander or dust mites, they can really trigger the same symptoms. And it's kind of dependent on what becomes exposed and how you're exposed how your symptoms present. It also depends on underlying factors such as whether a person has asthma that might predispose them more to lung symptoms versus the traditional itchy eyes, runny nose, sneezing, which the vast majority of allergy sufferers will experience.
You mentioned an interest in pediatrics. Do allergies affect kids and adults differently?
So they can. Again, the symptoms tend to overlap, but I would say the big difference with children is that oftentimes they're not able to communicate their symptoms effectively, or they have a hard time. So they might not be able to verbalize the fact that they're itchy or that their nose is stuffy, but you might notice them snoring at night or that they're rubbing their eyes more than usual. I've heard kids describe things in various ways, when their throat is scratchy, that they tell me that foods taste different or foods are spicier, or you might notice that their voice is a little hoarse. So we just have to pay more attention to the symptoms more closely because, again, the symptoms are the same, but they're just not able always to communicate what they're feeling.
We all have someone, friend, family member, coworker, who deals with allergies every season. Is this something that you just have to deal with, or are there tactics to, maybe get through the summer season, the allergy season, without the symptoms or with very decreased symptoms?
Yeah, so there are lots of things that people can do. For any allergy in general, the mainstay of treatment, in addition to medical treatments, which we'll get into, is really avoidance. And so for pollen allergies, unfortunately, there's not a whole lot we can do to strictly avoid those things unless you want to live in a bubble, which I'm sure most people don't want to do. So really it becomes minimizing your exposure, doing things like taking your shoes off before you get into the house so you're not tracking pollen in. If you're able to, keeping the windows shut in your house. I know that gets hard if people don't have air conditioning, but just to minimize the pollen getting into the house so you're not breathing it in all of the time. And then lastly, obviously, there are plenty of over-the-counter medications that can help with the symptoms as well.
So going to the pharmacist and getting something over the counter usually does the trick?
So sometimes those medicines, most of the time those medicines are very effective. Sometimes those medicines don't always work. And really the reasoning is because the over-the-counter medicines include things like allergy pills or tablets, which block histamine, antihistamines, which block histamine, which is something that's released by your allergy cells when you're having allergic symptoms. And then topical things like nasal sprays and eye drops, which really act to minimize and reduce the symptoms that you're experiencing, like the itching and the swelling and the redness. Now, those really are kind of putting a Band-Aid on the symptoms. And the reason they might not always be effective is because they're not getting to the root cause, right? So they're not really doing anything to address the underlying allergy. They're really just kind of covering the symptoms up. And in order to address the underlying allergy, there are additional treatments available, and that would be things like immunotherapy. And for that, you really have to see an allergist.
So when is it time to seek out an allergist or some, professional medical help for your allergies?
Really, just as we've talked about, when you've done the avoidance measures and you've tried a bunch of the over-the-counter medications and you do feel like, your quality of life is being affected, whether it's your sleep or your performance at work or school, or sometimes if you're just sick of taking medications, my symptoms are fairly well controlled, but I have to take medicine every single day and I really don't like to take medicine, or I don't like the way the medicine can make me feel because sometimes they have side effects like sleepiness or drowsiness. Then it's really a good idea to get evaluated by an allergist because, again, they can offer additional treatments like immunotherapy that get to the underlying cause for your environmental allergies and address it, and in some cases reverse or cure that. So for immunotherapy, which is given in the form of either tablets or injections, really the mainstay of that treatment is controlled doses of the things that you're allergic to in order to allow your immune system to build up a tolerance to those things. So not only when you're exposed, you don't get as many symptoms, but you also don't need to use medications as much.
What should I expect when I go to the allergist? Are they going to be able to pinpoint exactly what I'm allergic to relatively quickly? Does it take days to test? Is it invasive? What should I expect?
Very good question. So there are two main types of testing for environmental allergies, and that would be through a skin test that's done right in the office and through a blood test that can either be done at your doctor's office or at a lab. And those really test for the allergy antibody to anything specific like dogs and cats and pollens and things like that. The skin test results are available right away in the office, so they take about 15 to 20 minutes, and you'll have the answers right away. If we don't get those answers at the visit, then sometimes we will order blood tests, and then that usually takes a few days to come back. And as far as what to expect for the testing itself, I will tell you that the devices have changed in, recent years, and many of my patients that are children of parents who also have allergies are told horror stories about the type of testing and all the needles they had sticking out of their back. And really, it's a much gentler device that we use to just barely prick the surface of the skin in order to test for the allergies. So not too bad at all.
Is there a website that you want to give our listeners to learn more?
Yeah, so you can find out more about WellNow Allergy at wellnow.com/allergy. to learn more about the new offices that we're opening and where we offer services, for sure.
Dr. Lomas, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio.
Thank you again, Neil, for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jeanne Lomas, Director of Allergy Services at WellNow Allergy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.